India. So we were talking about health policy and how health can be a responsibility at individual level, at family level, and at central level, how it becomes so very important. And then uh, that is why the role of, what do you say, the role of national health policy, keeping in view women perspective, becomes very, very important. So today we will be discussing about Unit 15, Health Policy and Women, some important contents, and today also we will try to understand these concepts with the help of some very, very small brief videos, because these videos will help us to understand that how different kinds of initiatives are being taken up, and how health policy is just not one theoretical document. There are multiple aspects associated with health policy with specific reference to women in India. And this will impart a lot of freshness and a very practical, realistic perspective to understand the concerns of women's health and the policy documents connected with it. Now, before we talk exclusively about women's health, because when you try to see the literature with regard to the policy formulation in India, you will not get any exclusive literature connected with health policy exclusively for women in India. Because any health policy which is formulated, there are sections which is added on reproductive health. There are sections which are added on, nutritional health. And here, that is where women perspective gets added by default. So now, if we try to understand the emergence and evolution of health policy in India, it is very historical. I'm not going to go so much into back into history. I will start with a policy which became very, very prominent during the British colonial rule, and some component of it was continuing even after we attained independence. And what was that? That is what you call, as very popularly it is known as, Bhore Commission or Bhore Committee recommendations. So basically, Bhore or Bhore, it is because it's a common noun, you have the freedom to pronounce it according to your understanding. So this committee basically was Health Survey and Development Committee, which was appointed in the year 1943. And Sir Joseph Bohr was its chairperson. So it laid emphasis on integration of curative and preventive medicine at all levels. It made comprehensive recommendations for remodeling of health services in India. Now, see, just if we try to think of the perspective at how things were in 1943, right? And when we were still under colonial rule, what kind of socio-cultural and psychological environment was prevailing in those days, right? What was given more importance in terms of health, right? So, keeping in view all these things, basically, this committee wanted to collaborate, merge, and integrate two very broad aspects of any medical health care. They are curative, that is where you're emphasizing on curing any kind of a disease. And we all have heard that prevention is better than cure. So, of course, apart from talking about curing, we also talk about how we can prevent those diseases. What steps should be initiated to prevent those diseases? And this particular committee also gave very, very relevant recommendations that how entire health services in India should be remodeled. Now, in 1943, if you can imagine, or if you have done some reading on this, you will get an idea that there was still very strong presence of Ayurvedic system, and health infrastructure was not as exhaustive as it is today. So all these things also should be kept in mind. And there was very significant percentage of population living in rural areas. And how this committee wanted to address, I'm sorry, how this committee wanted to address all those issues with regard to rural health is also interesting to note. So, one very important aspect of the recommendations, in fact, it is a detailed policy document. Those who are interested, this policy document is available on the internet. You can go and read the entire policy document for you to develop an understanding that what was the vision of the people who wanted to have a health policy in 1940s before independence. So you will get a very good idea about it. So this committee basically spoke about developing primary health centers. So this, even today, if you talk about mm, grassroots level healthcare system, primary healthcare, PHCs, primary health centers are very critical component of it. So Bhore committee spoke about implementing that in short term and long term perspective. So short term perspective is one primary health center for a population of 40,000. Now, the 40,000 really looks a big number. Each primary health center was to be manned by two doctors, one nurse, four public health nurses, four midwives, four trained DIs, two sanitary inspectors, two health assistants, one pharmacist, and 15 other class 4 employees. Secondary health center was also envisaged to provide support to primary health center and to coordinate and supervise their functioning. So probably as part of secondary health center, we are including organizational hospitals. But with regard to primary health center, it did not have that scale of services, medical services, but definitely, probably all wouldn't even require that scale of services. So for concerns related with not very high order of diseases, primary health center could play a very important role in providing all the possible medical services. Then, when it comes long-term program, also called 3 million plan of setting up primary health units with 75 bedded hospitals. So you are extending and expanding the level of primary health center to a 75 bedded hospital for each 10,000 to 20,000 population, and secondary unit with 650 bedded hospital, again regionalized around district hospitals, 9 district hospitals with 2,500 beds. So you can get an idea that how extensive this of primary health center was envisaged to take care of the medical needs. And you might be thinking that why am I talking about this under this topic, health policy and women in India? Because if you want to understand health policy in India, we should definitely have some understanding of its historical context also. And that is why we are talking about. And major changes in medical education, which includes month training in preventive and social medicine to prepare social physicians. This is a very important dimension, because today when you're talking about entire field of community health, right? So in this entire field of community health, this concept of preventive and social medicine is its soul. You can say that social medicine is soul of the community health system. So when we are talking about health policy, as I told you, now when you're talking about, when you see the literature also, and you're talking about primary health center, you will not get exclusive data about women in that, right? So what we have to understand that uh, in the historical evolution of health policy in India, most of the concerns were of generic nature. Okay. And it is also very important for us to remember that it was only after 1970s, especially the year 1975, after which in many policies women-centric perspective or gender also was not there in 1970s. Gender perspective is being added last 2 decades, 2 or 2.5 decades in several countries, and in India I would say 2 decades, probably 1.5 decades to 2 decades. So gender perspective is a very latest perspective. Women related perspective as part of any policy, most of the policies, until and unless they were like Factories Act and all, where you're talking about what you say, maternity leave and things like that. Apart from very, very limited acts and policies, most of the policies did not have a specific demarcation for women. Okay, so that is why you will not find any exclusive information with regard to women when we are talking about historical evolution of the health policies in India. And then after we became independent, and you all are familiar that community development program was a very, very important program which again was talking about development at block level, and its most important emphasis was on agriculture. But in that also, community development project also, there was a reference to primary health unit. So it means what? When you are talking about having a primary health center or a primary health unit, you are thinking of institutionalizing the health system. Now, you might also get a question that why it is important to institutionalize the system. See, when you're talking about health policy, right? So to implement your policy and to make sure that the required medical services are being provided to every person, men, women, children, elderly, you definitely have to have an institutional perspective connected with it. And primary health center became very, very important component of institutionalizing healthcare in India. And as part of CDP, Community Development Project, this effort was also initiated. So, but see, the point what we are mentioning here is the health sector organization in the CDP was to have a primary health unit, a very much diluted form from what was suggested by Bore Committee. So you're seeing the difference now. Probably when Bore committee was talking about having a primary health center, they were mentioning how much staff they should have or how much population they should have. Per development block, in the 50s, this was about 70,000 population spread over 100 villages, supported by a secondary health unit, hospital with mobile dispensary for every 3 such primary health units. So basically, the idea is what? From Bore Committee in 1943 to establishment of Community Development Program in 1950s, there is a slight change, okay? But probably the spirit was trying to be maintained because until and unless you do not have primary healthcare system, it is difficult for you to have that kind of a sustainable rural health program. The aim of this health organization was improvement of environmental hygiene. Please remember, my dear friends, as part of community development program, if you're talking about health, you are talking in a very, very holistic perspective. That is why you're talking about water, hygienic conditions, proper waste management, all those things. So health is definitely a holistic concept, and this vision, this wisdom, our people had long time back itself, right? It's not that it came only in CDP, also much earlier also. Our ancestors also, they had this wisdom that health is a holistic concept. So in this, probably that vision that understanding that health is a holistic concept was also reflected as part of CDP. So the aim of this health organization was improvement of environmental hygiene, including provision and protection of water supply, proper disposal of human and animal waste, because if you're not having effective waste management, then that leads to a whole set of diseases. And with regard to water, I have already conveyed 2 3 times when in our discussion that even today World Health Organization has given a report that 80% of our diseases are connected with consuming polluted water, right? And then control of epidemic diseases, because see, those times there was greater risk of epidemics such as malaria, cholera, smallpox, TB, etc., and provision of medical aid along with appropriate preventive measures and education of the population in hygienic living and in improved nutrition. So, community development program included health as a holistic measure of development of the community, and that is why it is talking about multiple dimensions connected with community. So I hope the topic is clear to all of you friends. And then these discussions I am doing only to impress upon all of you that health policy has a very strong historical background. And then after that, for the first time in 1983, we had a full-fledged separate national health policy 1983 during sixth 5 year plan. And one of the main goals of this health policy was what? To provide universal health care. It means you are providing health care to all to the entire population. So this was the main goal, and it took us quite a long time to have a full-fledged health policy. So, see, we can see this thing in two ways. We need not jump into conclusion that health was not considered important. And that is why after 1947, it takes us 1983 to have a health policy. Of course, mention about the healthcare management and other dimensions, they were included as part and parcel of various 5 year plans, right? But as the population was growing, as the health related challenges were growing, it was realized that yes, now we should definitely have a separate health policy which can cater to the requirements of the various demographic groups, including women, right? Now it was critical of the curative oriented Western model of healthcare. Okay. It emphasized a preventive, promotive, and rehabilitative primary healthcare approach. Friends, when we are talking about that our health policy, first health policy had a very different approach when compared to today. Because see, in those times, what kind of health challenges were there and what kind of health challenges we have today? There is drastic change in that, right? So probably the health policies, first health policy, it was having a more of a, preventive approach. Let us prevent the disease rather than focusing more completely on curing part. Recommended a decentralized system of healthcare and the key features of which were low cost. Very, very important. Today, you see, healthcare is beyond the reach of many, many people. And if you, in one of the videos also, we saw that 61% of the healthcare expenditure is borne by an individual. So low cost, deprofessionalization. Now, today, if you talk about deprofessionalization as part of health policy, it will definitely not go well with anyone. In fact, government cannot think of having such a thing because Today, 2024, 31st May, our challenges connected with health is very, very different when compared to what was there in 1980s. So we have to understand this context. And then, so focus by using more and more volunteers, more paramedical staff, right? And also community participation. So today also we are talking about community participation. Today, if you have to spread awareness about any preventive measure connected with health, or you have to spread awareness about vaccination, right? Family planning, until and unless community is not participating. So whether it was 1983 or whether it was 1883 or whether it is 2024, without community participation, things will not move on the ground. This clarity we all should have. And that is why in almost every welfare scheme, every social development activity, community participation is at the forefront. Without that, things cannot be moved at the grassroots level. And then it called for an expansion of private curative sector. Now, see, today when you think that, okay, privatization is happening today only, it's not like that. Earlier also. See, earlier our health challenges were of a very different magnitude. We have to understand this. So, private curative sector, which would help reduce the government's burden. So, if people are having the impression that all the privatization of healthcare is happening today, they should read the policy document of 1983. Of epidemiologies were relatively very, very high. That is why this step was initiated. It set up targets for achievement that were primarily demographic in nature. So, what does this mean? We were trying to talk about different demographic groups. What should be done for elderly people? What should be done for children? Probably, and also how different population groups probably the focus was on that. Now, after 1983, we had another health policy, 2017. I'm not going into major features. I'm only focusing on some important indicators which is connected with women's health, and probably that will help us to understand that what they were trying to achieve. So specific quantitative targets were there. So the target is to increase life expectancy to 70 by 2025, probably by next year, and to a great extent we have achieved that. Reduce under 5 mortality to 23 by 2025. Achieve HIV AIDS target of 90 is to 90 is to 90 by 2020. Eliminate leprosy, kala azar, and lymphatic filariasis by 2018, 2017, and 2017 respectively, and reduce TB incidence to minimum achieve elimination status by 2025. So these are certain quantitative targets which were put forth as part of health policy. And in this one, two factors which are very critical with regard to women is under 5 mortality. Now, under 5 mortality is possible only if you are focusing on women's health, especially when she is pregnant, and postpartum health. And postpartum is part of when she's also lactating, where she has to feed her child, right? And here, it is just not question of nutrition of the mother and the health, but also of the environment in which the mother and children are living. That is why ASHA workers' entire perspective of services, it is holistic in nature. They're only not talking about facilitating nutritious diet to mother and child. Okay, they're also talking about other things. Health systems performance. So it includes increased utilization of public health facilities, and ensure antenatal. So this is very important from a women point of view. Ensure antenatal care coverage and skilled birth attendance above 90% by 2025. So these are some important dimensions of National Health Policy of 2017. Yeah, this I have written for my reference, refer PIB, as part of the explanation. Like the Ministry of Health and Family Welfare, they had also given a press release. So PIB is Press Information Bureau. That also I will be discussing as part of. So there is no denial that when you're talking about health policy in India, with specific focus on women, it is an essential aspect for building social policies and health policies. Whether man, elderly, woman, anyone who is falling sick in the family and unfortunately is diagnosed with certain critical diseases, we completely understand the kind of challenge what the family undergoes financially, the pressure what the family undergoes. And that is why uh, it is very important to not only focus on preventive health care, but also with regard to women. Why? Because if women is falling sick, it will impact the entire family. And secondly, women is like women has the honor of giving birth to children. That is why she undergoes that entire process of pregnancy, and after that, she becomes the natural caretaker of the child as a mother. So, if like when you're talking about children, children are the focal point of any family, and that is why women's health becomes very, very important at a family level and also at national level because today if women, whether man or woman, if they are sick, it has a direct impact on the economic development also. That is why we are saying that women's health in India is influenced by multiple factors, including socio-economic conditions, cultural practices, and access to healthcare services. So, whichever policy is coming connected with health and it has important components related with women's health, it has to take into consideration the socio-economic context and also the cultural context. Because if any policy is undermining this cultural context, believe me, it would become impossible for the policymakers to implement their policy. Now, when it comes to, now let us discuss some of the important health policies in different areas. And first, we will start with maternal health because when you are talking about women's health, this is most important component of women's health. So, in National Health Mission, which was launched in 2013, it encompasses National Rural Health Mission (NRHM) and National Urban Health Mission. So I would request all of you to also go through the policy document of what is NRHM and NUHM. If required, tomorrow's class, we can do some brief discussion on this so that you get a holistic perspective. It aims to provide accessible, affordable, and quality healthcare to rural and urban population with specific focus on maternal and child health and Janani Suraksha Yojana. It is a very critical component of health policy connected with women. So this is a safe motherhood intervention scheme under National Health Mission that promotes institutional delivery among poor pregnant women. Now, what is this institutional delivery? It is encouraging women to reach out to the hospital, to go to the hospital, and when she comes to know that she is pregnant, okay, and institutional setups are there. She undergoes proper checkups throughout her pregnancy period, and delivery also to take place in the hospital and not at home. When the delivery is taking place in an institutional setup, in a hospital setup, then to a great extent you are able to control the hygiene and also uh, ensure that the delivery takes place in a relatively sterile environment and not an environment where there can be very high risk of viruses and bacteria, because when the mother has just delivered, her immunity is at low, and the just born child immunity is also very low. So that is why infant mortality rates will increase. If the delivery is taking place in a home setup, infant mortality rates will increase to a great extent, and that is why through this particular policy of Janani Suraksha Yojana, all the efforts were made that even the poorest of the poor pregnant women, she is in a position to deliver the child in the institutional setup. It can be primary health center in a village setup, okay, or it can be government hospitals, district hospitals. Then you have one more very important health policy which caters to the maternal health. What is that? Pradhan Mantri Surakshit Matritva Abhiyan. Surakshit means safe and secure. Matritva means motherhood. Abhiyan means mission. Okay. So this initiative aims to provide free, comprehensive, and quality antenatal care to pregnant women on the 9th of every month. So antenatal is before the delivery. Okay. So when the woman conceives from the time of conception till the time of delivery, it is called as antenatal care. Then after delivery, it is called as postnatal care, or postpartum also it is called. So government wants to see with these kind of initiatives, what is happening? You are in a position to address maternal mortality rate, which becomes high if the delivery is taking place at home or in an unhygienic condition, and if the mother is not having proper balanced nutritious diet during her pregnancy, it not only impacts her health but also the child's health, and that is why antenatal care becomes very important. So whether it is Janani Suraksha Yojana or whether it is Pradhan Mantri Surakshit Matritva Abhiyan, the goal is to address and minimize maternal mortality and also infant mortality. Now, when it comes to reproductive health, friends, here you're seeing the side in family planning program. In fact, family planning program has been a very critical component of healthcare in India. And in a conventional society like India, it was very challenging and difficult to have uh, awareness about how to use the family planning method. It could be contraceptive methods or condoms or sterilization. How do you bring education? And that is why various contraceptive methods to help women make informed choices about family planning. So probably the onus of family planning was also on women, because if women is able to use contraceptive methods, which we also discussed in birth control methods, whether in form of pills or in the form of injections or in the form of spermicidals or in the form of copper T, right? These contraceptive methods can actually empower women to take a decision when she wants to have the next child. And I will show a brief video on family planning program so that you understand that it was not easy in a country like India to have family planning program. When you see it, you will understand its impact. And then Rashtriya Kishore Swasthya Karyakram. This is basically addressing the adolescent. Kishore means adolescent kids. Development needs of adolescents, including education is being imparted right from your ninth, 10th standard itself. So it is a very important initiative because see, today's kids have lot of exposure to all kinds of content, including pornography, right? And the age is such that you tend to be more curious, you tend to be more experimental. That is why we are also seeing that in many unfortunate cases, adolescents end up raping young girls and young women, and that is why, apart from this reason, sex education is also being imparted so that you are aware that what is your sexual need, how sexual health has to be maintained, and how it is important to refrain yourself from unsafe sexual practices. So I hope this point is clear. Now I will stop this screen share and show you one very interesting video that how uh, family planning in India became important. I also want to show you one video on menstrual hygiene. See, in India, for a very long time, talking about menstrual practices, talking about menstrual hygiene was not very much encouraged. And it is only that when Padman movie came, lot of efforts were done at that point of time, and that movie became very important to explain the significance of using sanitary napkins, because for a very long time women were using very unhygienic ways of you know addressing the menstrual challenges. One second. Now I'm sharing this screen with all of you, and I hope you will see the video and understand its essence. So, friends, I hope you really appreciate this particular video for the simple reason that, see, when we are talking about health policy, and especially in a populous country like India, see, populous country like India, and you want to communicate this idea of family planning in a very, very conventional society like India. It was definitely not an easy task. And you see, like if you have seen the entire video with a lot of thought, and if you want to, because it is available on YouTube, you can again see it. That family planning in India is not new. In fact, family planning in India, this initiative dates back to 1952 in India. So India was, I think it was one of the first countries in the entire world to come up with this idea of family planning. But again, how do you communicate to the population, which is very conventional, which is strongly rural based, with so much of taboos and so much of hesitation, our value systems, our cultures being so different, and that is why you see people talking how difficult it was to get to people you speak the word condom, right? And that is why, apart from that, how contraceptives were introduced to women and how awareness was spread. Today, I think by and large, when come decade back, we are much more comfortable using, and now technology revolution a lot has already happened. One more brief video I want to show. This is on mainstream videos is we have to understand that when you're talking about women's health, major part of the discussion of women's health is still a taboo in India. It is still a taboo in India. Even today, like, if you see, like, probably in big cities like Hyderabad, you have, Ratnadeeps, you have so many grocery stores, like, what is the exact word we should use? I'm not understanding. D-Mart here. My daughter is saying D-Mart, Ratnadeep. So many such centers where what you are buying, no one cares. But imagine in a rural setup or a mandal level setup, if woman has to buy a sanitary napkin, which is still very conventional. So menstrual hygiene is a very, very critical hygiene. It's a brief video which will help you to understand that how important it is to talk to spread awareness about it. That is hardly 2 or 3 minutes video, and this is the biggest advantage. I tell you, the biggest advantage of online class is this, where you can share with your students multiple ways of information in multiple formats. Only thing is, I wish we had uh, scope for discussion also. It is not to start in a couple of minutes. The video is still, yeah, it has started. Now this short movie, it is by United Nations. So you are able to see the rural setup here. So you are seeing its English translation in the subtitles. Yes. So this was the report which was produced by United Nations. Very, very important report with regard to menstrual hygiene. So see, basically, this is what I'm trying to communicate, my dear friends. Women's health issues has still lot of taboos lingering to it. Now, as you could see in this brief video, lack of awareness, and probably because of those taboos, those young girls, young women are not aware how to dispose them of, and especially because of the lack of toilet facilities in the school and so much of taboo associated with menstrual cycle, many girls drop out of the school. So when we are talking about women's education, right, it is also connected with women's health concerns, especially with when we are talking about young girls, and that is where school dropouts can be a serious problem. And that is why construction of toilets became one of the very important components of not only Swachh Bharat Abhiyan but also catered to making sure that the dropout rates of the girls do not go down, and I'm sorry, dropout. There are no dropouts for the girl students. And when we are able to introduce in our curriculum the various aspects connected with menstrual hygiene, civil society organizations trying to spread better awareness and educate the young girls, I think a lot of benefits can be achieved. So I hope you found these two videos beneficial, and wherever possible, see, whether you are a male or a female or any transgender person also pursuing this course, I request you to share this kind of information, this kind of awareness with your neighbors, with your family, in your village, in your mandals, wherever possible. And now continuing our discussion, when we talk about health policy, with specific reference to women in India, we have already discussed with regard to nutrition. We have very, very important scheme called as ICTS, integrated child development scheme, where the program has multiple dimensions. One of the most important dimensions is to provide food, preschool education, primary health care to children under 6 years of age and their mothers. And then we also have National Nutrition Mission, which is called as Poshan Abhiyan, which is a relatively new policy, new initiative, and this mission aims to improve nutritional outcomes for children, pregnant women, and lactating mothers. Then, as part of health policy, we are also talking about, because see, health is a holistic concept. You remember in all the health policies, this is there right from your community development program. So one-stop centers, which is providing all possible support to women who are affected by violence, including medical aid, police assistance, legal counseling, and temporary shelters. So even any kind of domestic violence can also impact women's health to a great extent, and that is why to address the challenges of domestic violence also becomes extremely important. Ujjwala scheme, where is designed to prevent trafficking and rescue, rehabilitate and reintegrate victims of trafficking, and as part of that also, you also have LPG provisions as well. And then policies connected with non-communicable diseases, how government has launched various programs for early detection and treatment of non-communicable diseases such as breast cancer and cervical cancer, and routine screening, which is encouraged to a great extent at the primary health center as well. Then menstrual hygiene, just now we saw in that video how important is that. So as part of this scheme, sanitary pads are provided to adolescent girls, especially in rural areas, at a very, very subsidized rates. And more awareness programs are being organized by civil society organizations, by various agencies who work along with Ministry of Health and Family Welfare, so that that stigma, that taboo associated with menstrual cycle can be spoken. People are in a position to talk about that in a very, very open manner. So friends, I would rest my class with this slide. We will continue about challenges and issues in tomorrow's class. Tomorrow we discuss this topic and we will also initiate the last unit. So thank you all so much for joining me for today's class. Have a great evening. See you all tomorrow at 8 o'clock. Thank you all, friends. Thank you, host from B.R. Ambedkar Open University, for hosting the class and session. Thank you all so much, friends. Bye-bye.